Welcome. In this video, we will answer 5 pharmacological practice questions. I will also explain why we came up with the answer to better understand them. So without further ado, let's begin. Question number 1. Which one of the following antihypertensive drugs can precipitate a hypertensive crisis following abrupt cessation of therapy? A. Clonidine. B. Diltiazem. C. Enalapril. D. Losartan. Answer: A. Clonidine. Increased sympathetic nervous system activity occurs if clonidine therapy is abruptly stopped after prolonged administration. Uncontrolled elevation in blood pressure can occur. Patients should be slowly weaned from clonidine, while other antihypertensive medications are initiated. The other drugs on the list do not produce this phenomenon. Question number 2. Which one of the following drugs may cause a precipitous fall in blood pressure and fainting on initial administration? A. Atenolol. B. Hydrochlorothiazide. C. Nifedipine. D. Prazosin. Answer: D. Prazosin. Prazosin produces first-dose hypotension, presumably by blocking alpha-1 receptors. This effect is minimized by initially giving the drug in small divided doses. The other drugs on the list do not have this adverse effect. Question number 3. A 45-year-old man has recently been diagnosed with hypertension and started on monotherapy designed to reduce peripheral resistance and prevent sodium chloride and water retention. He has developed a persistent cough. Which of the following drugs would have the same benefits but would not cause cough? A. Losartan. B. Nifedipine. C. Prazosin. D. Propranolol. Answer: A. Losartan. The cough is an adverse effect of an ACE inhibitor. Although the other agents on the list also do not cause this side effect. Losartan, an ARB, not only will not produce cough but will also have the same beneficial effects as an ACE inhibitor. Question number 4. A 66-year-old man had a myocardial infarct. Which one of the following would be appropriate prophylactic antiarrhythmic therapy? A. Lidocaine. B. Metoprolol. C. Procainamide. D. Quinidine. E. Verapamil. Answer: B. Metoprolol. B blockers, such as metoprolol, prevent cardiac arrhythmias that occur subsequent to myocardial infarction. None of the other drugs on the list has been shown to be particularly effective in preventing post-infarct arrhythmias. Question number 5. A 58-year-old man is admitted to the hospital with acute heart failure and pulmonary edema. Which one of the following drugs would be most useful in treating pulmonary edema? A. Digoxin. B. Dobutamine. C. Furosemide. D. Minoxidil. E. Spironolactone. Answer: C. Furosemide. Furosemide has the ability to dilate vessels in the context of acute heart failure. It also mobilizes the edematous fluid and promotes its excretion. Dobutamine increases contractility but does not appreciably improve pulmonary edema. Digoxin acts too slowly and has no vasodilating effects. Minoxidil decreases arterial pressure and causes reflex tachycardia. Spironolactone does not alleviate acute pulmonary edema.